So my name's Sonu Gand. I'm the Chief of Psychiatry here at Humber River Hospital. I have been here since 2014 when I came over to take on the role as Chief after coming from Princess Margaret Hospital at University Health Network downtown. So as Chief of Psychiatry here, my role is to work with our senior team and with the management and docs and all of our allied health professionals in mental health. We have a remarkable program here at Humber. It's a large program, actually one of the largest in the city. And in terms of the role, I have the privilege of working with all of my colleagues in ensuring that we are providing the highest quality of care to our patients, to our community, and also for our own team, our kind of collegiality and interaction being a positive one. And I've loved working here in that capacity. I also do some clinical work, mostly with the oncology population. So my background prior to coming here was, as I mentioned, at Princess Margaret Hospital. And clinically, psycho-oncology is my particular area of expertise and practice. And so I have connected with our oncology colleagues and team and enjoy working with that patient population here clinically. I've just successfully come on, or will be coming on, for my second term as a governor at University of Toronto. That's under the auspices of the Governing Council. We have elections every 3 years. So I had my first term, 2019, would be wrapping up at the end of June this year. And then the second term will be starting July 1st for a period of 3 years. And Governing Council, that's the body that actually has oversight for all university functioning. We are unique at U of T in terms of our structure, that we have what's called a unicameral system. So up until about 50 years ago, the university had both a Senate and a Board of Governors. And 50 years ago, we went from that bicameral model, which most other universities have, to a unicameral model of having one joined governing council, which is meant to have oversight of all of the academic and business roles of the university. And it's worked very well. We've got a unique structure that way. And through Governing Council, there are also other boards like the Business Board, the Academic Board, and the University Affairs Board that have oversight over the various components of university life and functioning. And there are campus councils as well. So in my role as a governor and on those various boards, I have been able to interact with colleagues and peers both in medicine and outside medicine, and just get a sense of what university life is like for the range of students, teachers, and staff that are part of that university. And it's been a tremendous pleasure and honor to be able to do that, because it's, again, I think it's a pretty remarkable university. Part of what drew me to Humber River Hospital was the ability to keep connected with the university in an academic role, and also to work in a community site. And it's been a really nice mix for me, and what I've been able to do is to continue with my scholarly career and academic career at the university. And last year was promoted to full professor. When I came here, I would have been an associate professor, and I was successful last year at being promoted to full professor. The academic role, I think, is important because it helps to teach our next generation of what we are striving to do for clinical care for our patients, for their own education. And the Faculty of Medicine, Department of Psychiatry, again, really encourages interaction with community-affiliated sites like Humber. So in addition to being a full professor, I've actually had the opportunity to take on the role as co-director of one of our largest divisions in the Department of Psychiatry, the APHS, Adult Psychiatry and Health Systems Division. and to work with colleagues on our Senior Advisory Council in the Department of Psychiatry. And it's really reassuring to see how community and, for lack of a better word, core downtown sites have the opportunity to interact to improve patient care and education. When you get promoted to professor, you have the opportunity to give what's called a professorial lecture. And this is not meant as a traditional academic lecture. It's more of a celebratory thing where you actually have the chance to review the journey that brought you there and acknowledge colleagues you've worked with, things like that. My professorial lecture is actually coming up in May, on May 9th, and I'm really looking forward to that and engaging with my peers and colleagues. Any of the Humber family who would like to watch, because these are now being done virtually, they're more than welcome to. The more the merrier, and I think you'd get a sense of what the university is like through experiences like that.